Hi guys, welcome back to another video of Eduate channel. So today's topic will be from systemic veterinary medicine, that is unit 2 of veterinary medicine as per new MSV system. So today's topic is general management of gastrointestinal disorders. So we have seen many gastrointestinal disorders in the digestive system medicine. So we need to have a balanced idea and a best idea to treat the animal with GI disorders. So GI disorders or gastric problems is very common in case of field condition. So we have to study the general management of GI disorders. So if you haven't subscribed this channel yet, feel free to subscribe and hit the bell icon for more updates. So moving to the introductory part. So the primary function of alimentary tract is prehension and digestion of the food. So in order to perform these functions, the alimentary tract should maintain normal motility, normal secretions, normal digestion, and normal absorption. So these four processes are to be maintained in a physiologically smooth manner for the proper functioning. So if at all there is any alteration in these functions, there will be a rise of pathology. So the alimentary tract dysfunctions can be explained under four modes. So those four modes are abnormal motility, abnormal secretions, abnormal digestion, and abnormal absorption. So in these four categories, we can include all the problems. So the clinical manifestations whenever an animal is having digestive disease or digestive system disorders are: first one is dysphagia, that is the inability to swallow, that may be arise from any painful condition of the oral cavity or malocclusion of the teeth or any teeth problems or any problems associated with tongue, pharynx, larynx, etc. So the next is actually drooling of saliva or excessive salivation. So that is mainly seen in case of stomatitis or any hyperplasia of the glands of the digestive system, sweat glands, sorry, the parotid glands and all. So next is in case of rabies or in case of poisoning and all, we have seen this. So next is halitosis. So next is vomiting and regurgitation. So whenever the animal is having liver diseases, kidney diseases, or any gastritic problem is, obviously they will be seeing, like they will be having a action of vomiting or the problem of vomiting and some problems associated with the regurgitation, all will be there. So these are the other things, that is hematemesis, that is appearance of blood in the emetic fluid, that is actually mainly found in case of parvoviral enteritis and leptospirosis. So diarrhea will be there or melena will be there, that is melena means presence of blood in case of fecal matter. Diarrhea means it will be complete loss of intestinal motility. So that is next is hematochezia will be there. So constipation will be there. Scanty feces will be there, that is actually due to decreased food intake and all. So next is alimentary tract hemorrhage will be there. Abdominal pain will be there, that is actually in case of gastric dilatation volvulus or distension of intestine with gas or intestinal intussusception, peritonitis, etc. So next is tenesmus, that is actually retention of feces of urine or fetus in the uterus. Next is abdominal distension will be there. Fecal incontinence will be there. Weight loss, dehydration, anorexia will be there. So in general, you will be seeing these things, that is dysphagia, drooling of saliva, halitosis, vomiting and regurgitation, hematemesis, diarrhea, melena, hematochezia, constipation, scan feces, alimentary tract hemorrhage, abdominal pain, tenesmus, abdominal distension, fecal incontinence, weight loss or dehydration, or anorexia or hyporexia. So moving to the diagnosis or the special examination, so we will be evaluating the fecus matter or the feces. So gross evaluation of feces for color, consistency and odor, and the microscope examination for parasitic appearance. So next will be fecal sample for detection of virus. We'll be going for a rapid test kits for canine parvovirus, and also now it is present in case of canine December. So next is fecal smear for cytological evaluation. So next is fecal digestion test, that is we will be digesting the fecal matter with some enzymes or some items so as to check the pancreatic insufficiency. We will be checking the power of pancreatic enzymes. So next is actually the rumen intubation. So it's actually passing some tubes to the rumen and evaluating the ruminal fluid contents or the appearance of gas, bloat and all. So next is rumen fluid evaluation, that is determination of the color, consistency, odor and pH. Next is nasogastric intubation to determine the patency of esophagus, decompression of stomach to relieve gas, etc. Next is orogastric intubation in case of dogs and cats. So next is complete blood count and serum biochemistry. Next is abdominocentesis, that is actually mainly done for peritoneal fluid correction and evaluation. Next is medical imaging, that is ultrasonography, which is also known as USG, and also we can go for X-rays. So endoscopy will be there, liver biopsy can be done. So general principles of treatment, first of all, we have to remove the primary cause, which is the most important component of any chemotherapy, that is removal of the primary cause. So however, in most instances, therapy is symptomatic. So we will be going for symptomatic therapy. So the general principles of treatment in gastrointestinal disorders are relief of abdominal pain. So it is not ethical to leave an animal in pain as per animal ethics. So relief of pain also prevents self-mutilation injuries. So whenever an animal is having internal pain, it will be like having many mental stress, and they might even hit at objects to make the pain reduce, but sometimes it may get hurt and it may produce another injuries. So narcotic and non-narcotic analgesics are in general use. Narcotic means mainly we'll be going for opioid analgesics, and non-narcotic analgesics will be mainly belonging to the NSAIDs category. So example, NSAIDs, butarphenol, buprenorphine, dicyclomine, etc. Those are the to relieve the abdominal retention and the tenesmus problems. Will be given some skeletal muscle relaxants and all. So next is relief of distension. That is mainly distension of rumen with fluid or gas sometimes will be there, and we will be going for procreation or the rumen at the left parallel fossa. So sometimes frothy bloat in ruminants is difficult to relieve and they may create many problems. Also, we are doing nasogastric intubation in houses, and also distension due to accumulation of food materials. We will be going for laxatives or purgatives. Distension due to physical obstruction are almost very common, but we are going for either removal, either laxative or purgative, or we will be going for surgery. So next is distension due to functional obstruction or due to lack of motility. We will be going for some prokinetic drugs such as metoclopramide or domperidone, whereas metoclopramide will be having central action and peripheral action, and domperidone will be having what action? Peripheral action mainly, and those are dopamine drugs. So next is the replacement of fluids and electrolytes. So if thirst is evident, give water orally, more water orally, so it can prevent dehydration. If not, water giving through oral condition is not happening, means we can go for either parenteral routes. So next is correction of abnormal motility. So increased motility will be creating some intestinal parasites or indigestion problems will be there. So mild to moderate diarrhea can be addressed by giving oral intestinal astringents. In severe diarrhea, we should go for the drugs that would decrease the intestinal motility, that is example loperamide. Next is correction of abnormal motility, that is increased motility with spasm. So they will be kicking off the belly and all, frequent lying will be there. So drugs such as atropine will be anticholinergic action, or dicyclomine or butarphenol are used to treat this intestinal spasm. Decreased motility problems in case of abomasal emptying, gastric dilatation will be there. So it is addressed by giving motility enhancers, that is mainly the prokinetic drugs such as metoclopramide, cisapride or neostigmine with oral fluids and fecal softness. So next is mainly motility enhancers are contraindicated in animals with physical obstruction. So here surgical intervention is the best strategy to be the best procedure. So in practice, if surgical intervention is not possible, these drugs are used as choice of last resort actually. Metoclopramide, cisapride, etc. So moving to the management section. So first of all, we have to go for relief of tenesmus. Next is antiemetics, that is mainly metoclopramide, etc. So next is antacids will be there, that is triple carb, ranitidine, pantoprazole will be there. Next is intestinal protectants. So whenever there is the problem with microorganisms, they will be attacking the intestinal mucosa and they will be degrading the intestinal mucosa. So we have to go for intestinal protectants such as sucralfate, choline, and aluminum hydroxide. Sucralfate is mostly used in case of canine parvo gastroenteritis. So digestive enzymes, zymopet liquid can be given. Dietary management, that is low protein, low fat is prescribed. Then we can go for carbohydrate rich. So up that normal GI motility is restored. So next is reconstitution of rumen flora and correction of acidity. Rumen acidity should be corrected by giving magnesium oxide or magnesium carbonate orally. So next we'll be going for some anti-inflammatory and anti-secretory drugs. Sulfasalazine is used as antibacterial anti-inflammatory drug in case of colitis. So corticosteroids such as prednisolone are used in case of chronic inflammatory bowel disease such as non-responsive to antimicrobials. So next we'll be going for antibacterial drugs, that is amoxicillin, sulfactam, clavulinate, amikacin, cefpodoxime, etc. Metronidazole is also used whenever there is infection due to anaerobic organisms such as many Campylobacter species, etc. So next is probiotics and prebiotics. They will be actually producing the prebiotic therapy or the symbiotic therapy, and they will be enhancing the digestive juices, and they will be making all those actions very proper. So anthelmintics should be given at a random intervals. So next is enema. That is, if at all retention enema is there, we can cleaning enema also we can go, or phosphate enemas. Next is laxative and cathartics. Thank you.